What other symptoms do you see that are associated with this? We're talking jaw pain, obviously, but what I mentioned before was some vertigo symptoms, some central nervous system symptoms, neck pain, headaches. What other things do you see jive with this?
Yeah. So very, very common with jaw pain is going to be migraines and headaches, right? Additionally, it can even be perceived as neck pain. So patients can come in with neck pain, and you may have had this experience. Sometimes someone comes in with neck pain, we're adjusting the neck, we're adjusting the upper back, we're doing everything that we think that we should do, and they're not getting better, right? And then all of a sudden you adjust their jaw and the neck pain goes away. Or a lot of times chiropractors are treating headaches and migraines by adjusting the upper cervical spine, the atlas, the first bone in your neck, the occiput where the skull sits on the neck, huge ones for headaches and migraines. A lot of times that's enough to clear it up. Sometimes it's enough to clear up 80% of it, but that lingering 20%, we're just not able to make a change. And what I noticed in my practice when I started adjusting the jaw is that final 20%, or even stubborn headaches and migraines that I wasn't making a difference with by adjusting the neck, started to go away. So the mechanism behind that, without getting too nerdy with you, right? The TMJ provides sensory information, and a lot of us learned in school that that's through the trigeminal nerve, so cranial nerve 5, right? And what we learned in school is that's a straight pathway to the brain, right? Only some sensory information coming from the jaw goes straight to the brain down that cranial nerve. It'd be things like temperature and threshold, stuff like that. Other information, specifically pain, actually takes a pit stop down into the neck, which is interesting. So there's a structure in your neck. It's between about C1, C3. And it's called the trigeminocervical nucleus. And at this area, we have pain processing information coming from the TMJ, coming down into the neck before ever going up to the brain. And at that same level, we also have sensory information from the upper cervical nerves, so things that supply the back of the skull and the upper back part of your neck. Those also come in synapse, and then they share the same second-order neurons. So basically think of roads coming together onto one single highway, right? So they share that highway up to the brain. The problem is when that happens, especially when we start to get pain, is we can get poor localization. So if you had to figure out which car came from which road leading onto the highway, sometimes we're great at that if we're really paying attention. But if you've got other stuff going on, or your brain's capacity to determine location goes down because we're stressed out, we're fatigued, we're not getting enough sleep, your brain can start to guess wrong. So it starts to say, hey, we've got pain in our neck, when that pain actually started as a signal from the jaw. Hey, we've got pain in the back of our head. I have a headache, when that pain actually started from the jaw. Right?
Interesting. So more referred pain.
More referred pain. And the longer that this goes on, the wider that receptive field is going to get. So that pain starts to spread out more over the back of the head. So more of the head's involved, more of the neck is involved, more of the jaw and face is involved. And it gets worse and worse as that patient gets more sensitized. So that's why I think personally it's foolish to treat the TMJ in isolation. If you're treating someone's jaw, we need to at least be evaluating the neck, because it is going to play a huge role in the function of the jaw. Every time you open your jaw, your suboccipital muscles have to work to help stabilize the skull in relation to your jaw. Right? And so every time we're speaking, every time we're eating, we've got this little interplay between the jaw and the upper cervical spine.
Right.
So we need to be evaluating and treating those together, but you'll find that you make huge strides in upper cervical pain and headaches and migraines when we start evaluating and treating the jaw.